Hello everyone and welcome to today's ODI Fridays talk. I'm Hannah Folds, Head of Marketing and Production at the ODI, and it's my pleasure this afternoon to welcome Danny Bluestone, CEO of Cyberduck, a leading full-service digital agency, and ODI members, no less. Very little health data is computerised, so how is data about us being managed? And how can we ensure that this is being communicated? Danny will be discussing these important questions today. Just a few things to note, today's talk will be recorded. So if you're in the audience, please turn off your mics and your cameras while Danny's talking. If you've got any questions for Danny, and please do ask questions, please put them into the chat and I'll ask you to read them out at the end, or please indicate if you'd like me to do that on your behalf. I think that's all from me, so over to you now, Danny.
Hi everyone, so let me just share my screen. Cool, so yeah, it's fantastic to be here. Hopefully you can all hear me okay and see the screen. So I'm going to be talking about electronic health records and transforming the patient experience. It's something that I am very sort of passionate about, both as a user and obviously a practitioner who works in digital as well. So the talk today is pretty much going to cover the landscape of electronic health records, some of the challenges that exist, as well as how user-centered design as a solution can help to almost complement what is happening at the moment, and of course the kind of the future, and looking at a couple of exemplars and examples of where things are heading really. So just a bit about me. Pretty much had a keen interest in computing, design and data since the 80s. I started to become a practitioner in the late 90s, primarily working as a Flash designer and developer. If you remember what Flash was, it's something that I used to get very excited about. But I then took a master's degree in design for interactive media, which was essentially a precursor of UX. And then sort of started Cyberduck in 2005 with a view to kind of bridge the gap between data, design, technology, and content. And today we're a digital agency focused on digital transformation through user-centered design and web technology. So essentially clients come to us with large sort of data and content problems. And our clients include governments, intergovernmental organizations like the Commonwealth, European Union, as well as the British government. And then we also are fortunate enough to have a lot of clients in the private sector as well, in healthcare, financial services, and education. So this sort of holistic view of different industries really gives us a lot of insights into problem solving. And as I mentioned, it's very sort of quantitative as well as qualitative, in a sense that we get to talk to a lot of users to really understand the why and sort of navigate around, not only what are the issues, but why the issues are happening. And I think sort of being grounded with user-centered design is a massive kind of benefit, because it keeps us close to the people, but also enables us to really develop excellent user experiences and develop software that actually works for users. So yeah, I'm just going to cover sort of a brief intro, I guess, to electronic health records. So why do we need them? Well, essentially, effective health data enables the sort of 3 Ps of healthcare, which is prediction, prevention, and personalized medicine. And ultimately, when everything is digitized properly, medical professionals will be able to deliver better healthcare to us and our families, save more lives, and empower the patients to act sooner, actually. And this sort of subject is very close to me. So recently, this is my brother who was sort of featured in the press. He's a musician, but he was talking about us as a family almost losing our mother, because she ended up having to have like emergency heart surgery, and she she just didn't have any data to sort of guide her or her doctors. And I think if herself and her doctors and medical practitioners were informed by better medical data, I think that potentially we could have avoided the situation that we ended up in. Luckily, she made a full recovery. And yeah, data does save lives. We've known this since the 19th century, how important data actually is. This map here demonstrates a clear pattern correlating sort of deaths to water sources. So obviously, again, a great discovery made by Dr. John Snow in the 19th century. And it's happening even today. You know, the same thing happened in 2020 when, you know, I think the NHS in this country did a great job of doing sort of data gathering and data analysis with dexamethasone. You know, it saved millions of lives all over the world. And essentially data is being kind of generated in lots of different places now, you know, so from sort of wearables all the way to, you know, cloud kind of computing. More and more data about our health is being gathered in lots of places. Now, whether something like a wearable is medical grade, again, that's a controversial subject. Some people agree, some disagree. We're obviously not going to go into that now, but the whole point of this is that there's lots of data being generated. It's sort of, I guess, healthcare being left behind. So if we look at this, we can see that without clinicians getting the right data, you know, within the right interface at the right time, medical mistakes are being made and will be made. Illegibility, for example, is a huge problem where, you know, the conversion issues that you see in this graph, where potentially practitioners are using a combination of hybrid paper and digital, is causing 13% of failures with regards to electronic health records. So this is a Harvard study from 2017. And just to kind of give this a bit of more of a personal kind of look, as you can see, these sort of issues with electronic health records can cost lives. This is a tragic story here of a toddler who was sadly in America given 20 times the dose that she actually needed when she was in hospital. So this is a matter of life and death simply because the clinician didn't read the data correctly. And there is, of course, a huge kind of polarization of how electronic health records are being employed, both from a practitioner in a clinical setting as well from a patient experience. This is two different apps. One is the NHS app. One is an app in Israel, and also countries like Estonia as well have sort of a complete or total digitization of all kind of touch points, all kind of records and all interactions with patients are essentially completely digitized in countries like Estonia and Israel as well. Yeah, we'll talk a bit more about this later, about some of the comparables later on in the talk. And in other industries, as you can see in this example, like the financial services sector, things like open banking have definitely kind of paved the way and provided kind of almost like a shining light onto what could potentially happen in healthcare, where the Competitions and Markets Authority, or the CMA, force kind of banks to open up their data through new secure standards and APIs. So if monolithic banks can connect their data, why can't, you know, pharmacies, hospitals, insurance companies, trusts, you know, even when you go to like more of a auxiliary healthcare professional, like you know, a chiropractor or someone like, you know, someone like that, for example, why can't they see you know, your scans on file? Why do you have to either send them emails or bring CD-ROMs? And in this kind of, hopefully you can get the video to work here. But you can see, you know, so for example, all of your accounts in one place, everything is connected. And this is kind of what open banking or PSD2 as it's called has done to the financial sector industries. So certainly, I think it's a great example of connectivity and different sort of completely different systems connecting up. Of course, you know, so there was a pledge in 2018 again to go so by 2020 to be completely paperless. That obviously hasn't happened. So this is an article from 2020, and in the same year, like in 2018, 94% of trusts were still using handwritten notes. So that sort of digitization still hasn't happened. Now, at Cyberduck, as I mentioned at the beginning, we talk to users to try and understand, you know, what they think about all of these things. So this is a quote from a particular user where essentially they're saying that it would be good if there was better connectivity between the departments, because essentially they're having to act as the conduit, you know, between all the different professionals that they see. And naturally, somebody with complex, you know, medical needs will obviously have a lot of paperwork and files that they need to carry around. So if things are digital, it inherently makes everything a lot easier. And obviously the issues aren't just UK specific. This is not about the UK being behind. This is actually about, you know, the global society being behind. This is a good quote from a Spanish hospital where the CEO was basically saying there were virtually no electronic health record sharing across Spain during the first wave of COVID. So you can see where you can already see why this is such an important topic, because even if there were errors made for, you know, 2 or 3%, we're talking about, of those patients, we're talking about people's lives here. So in terms of like the current situation that we're in, and obviously the current sort of solutions, firstly, we need to sort of remind ourselves that there's been many initiatives to digitize health records, but, you know, from obviously Tony Blair all the way to 2014 with a project called care.data, which tried to link all of the patient records together. But again, it sort of fell down due to confidentiality, workability issues, and these sort of problems still exist today, 7 years later, with the current sort of initiatives as well. One of the key problems is obviously security and trust. So probably one of the most famous and largest ransomware attacks in the world sadly happened to the NHS with the WannaCry attack. It was the biggest ransomware attack in history. You know, and it probably could have been prevented. You know, was it not prevented because of budgetary issues, because of, you know, process or kind of other constraints? It's not entirely clear, but clearly it's eroded public trust. So this is another quote from somebody that one of the users that we spoke to, where people are essentially unsure if the NHS has the technology and resources to make their or sort of create like an ecosystem of an environment where their data can be truly managed securely. There are also various kind of accountability questions. So this was a study from a couple of years ago where almost 10,000 patient records were reported as missing. You know, so clearly more needs to be done there to protect the identity of and kind of the privacy of patient records and integrity. And clearly, you know, the access to those kind of records should really be given to us as, I guess, consumers or patients, so we can actually see what data is held on us in the first place. And this kind of ties into the NHS sort of latest initiative. So obviously, I'm sure you've all seen this in the news. It's literally kind of in the last couple of weeks where there was supposed to be a kind of cutoff point to, you know, opt out of having your data scrapped, but there's still, you know, there's a big nervousness and issues around and confusion around, you know, what are the big tech companies going to be doing with the data? And I think this is where it's really important to converse with users and understand how they feel, and just get that qualitative view across obviously the different cohorts or demographics that exist. But from the users that we spoke to, I just wanted to share one quote where the user said, that obviously they're fine for their information to be shared anonymously for obviously medical research, but they want more transparency on how their data is going to be used and what it's going to be used for. And I think it kind of goes back to what a lot of people see on social media and the news, and how obviously the government is communicating with users about all of this kind of effort. And again, having sort of one sort of centralized data storage solution isn't a bad thing. And bringing kind of, analysts and medical researchers to the data source to essentially process the data and kind of learn from the data is something that's been widely happening for decades. As an example here, the census data is accessed by a variety of analysts and researchers. So this is a screenshot from the Office for National Statistics. And again, this has been happening now for decades. And I think the reality is, and again, the pandemic has obviously been a big driver in this, is that people want everything now to be digital. In terms of the people that we've spoken to, it certainly is the case. I don't think anyone particularly likes walking around hospitals with folders of paper and having to print letters. It's not really a efficient kind of way to live our lives, and for obviously medical practitioners to access our information and having to scramble and read people's handwriting. And so users are demanding kind of control and connectivity, not just for the health professionals, but for themselves. And this is where this kind of NHS number comes in. It's obviously a unique identifier to all of us. And I think if you go back a few decades, I think the government was struggling to find this kind of unique identifier. So it's pretty much been around since the early 2000s, where every sort of child that is born is given this number, and anyone that's registered with the NHS can essentially approach them to get their NHS number. The problem with it is it's still not widely advertised, and a lot of the users that we spoke to, especially kind of within, a demographic that is a younger demographic, let's say people in their 20s, 30s and 40s that have relatively few health conditions, haven't heard of the NHS number, and they only really heard about it since the pandemic. So what you can see here with this particular Google Trend graph is the NHS number started to spike when we saw the vaccination drive, and that's when people started to Google, what is my NHS number? There was very little kind of awareness of this from the research that we've seen until sort of December, January 2020. So in terms of like the user-centered difference, this is where we believe that user-centered design as a solution can really help to kind of frame and ground all of us. When I say all of us, it's like obviously digital professionals, healthcare professionals, government officials, to sort of really understand, why they have concerns, because sometimes you can just get lost in the data. And I think user research is a really great way of getting qualitative validation and inputs. So in terms of some of the findings that we found, so we had one of our researchers look into this. In terms of pain points around electronic health records, there's clearly kind of communication issues where the different teams aren't talking to each other, the medical teams, and there's inconsistencies into obviously how data is recorded and accessed and shared. Some of the users complained that there's an information overload. So when they, for example, go into the NHS app, there's too much information and they're not actually finding the information that they need. And when they find the information that they need, there's not enough information. So it's a bit of a kind of paradox, but kind of make sense in a context. Some users, as I mentioned before, with the NHS number, are unaware that they can even access their medical or digital records. Other sort of concerns that are emerged is people are concerned about privacy and of their data and confidentiality, and sort of past negative experiences when data was handled correctly. I mean, I remember when my second child was born, they had my address down as like the Isle of Man or somewhere like that. I mean, God knows where they got that from. And it's just like, obviously multiple errors are being made, which I think all of us see on a sort of regular basis, as well as a need for more transparency about, you know, how and why the data is shared with third parties. And I think a big problem is kind of how the government is communicating the need to digitize these electronic health records. And it's just sort of coming, I think, the intentions are good, but I think the communication is bad. And I think there's a whole kind of marketing problem around trying to sort of almost market the need to digitize and how literally the details of how the data, where the data is going to be stored and how it's going to be handled. In terms of some of the motivations, some people need to actually access records for work purposes, even for like job interviews. And I think if you think about these kind of need states and you get the sort of qualitative input, it does change the way that you look at the app and webs, you know, and what potentially could be on a website as well. Some people need need the medical kind of data to look at their vaccination status, as well as kind of having sort of a one-stop digital solution for all of their interactions with the NHS. But you know, not everyone can use the app, and I think a website would also be a logical place to kind of house that data. And crucially speaking, you know, it would be great for people to walk into a pharmacy and for the pharmacist to have kind of all of their medical kind of records, so they can actually get a repeat prescription without potentially having to go to the GP. I'm not saying that in all instances that should happen, but it would definitely empower the pharmacist to see a medical history and record. And what's sort of very clear, I mean, this comic applies to sort of digital transformation, you know, and how it's been impacted by COVID in kind of more of a business sense, but actually this comic applies to the healthcare, as well. Patients have become, during the pandemic, much more comfortable with remote and computer diagnosis and obviously treatments. And this is kind of backed up by the user research that we've done at Cyberduck, where the vast majority of the population now are becoming very comfortable with digital, and that's providing that the digital kind of experience is inclusive and accessible and kind of takes in mind, you know, user limitations, disabilities, you know, cognitive kind of disabilities as well. So I think that the NHS and the government have recognised all of this, and they did release this, I think sort of a couple of days ago now, 3 days ago, that user involvement is obviously pivotal for this kind of new data strategy or policy paper that was released by Matt Hancock. And you know, one of the things that they have recognized is that patients or the general public need to be involved in this health data strategy. At the moment, I think the intention is there. I think the government is trying to do the right things, but I think it's struggling to communicate and to market, you know, the clarity of basically the situation. And I think it can be improved. And I think saying that, I think the intention is there, and hopefully will improve. So just kind of in terms of the data sort of, I guess, difference between different sort of countries and locations. So if we look at countries like Estonia and Israel, which are again far smaller countries than the UK, so it's 10 million people in Israel, but obviously again extremely ahead when it comes down to digitization of medical records. And I just wanted to show you a couple of examples of kind of how our kind of, I guess, app or access to medical records compares to their app. So on the left-hand side, we have the NHS app, and on the right-hand side, we have the app from Israel. And obviously I put in kind of the translation there for you, but essentially with this particular app from Israel, you can view your medical records, you can book appointments, you can chat to your doctor, you can even there's even a ticketing system with doctors as well. You can also view the results of all your lab tests within the app itself. Whereas our app is kind of a bit more limited. So when on our app, if you look at the left-hand side, when you click on view your GP health record, what it actually displays after lots of sort of scrolling and tapping, so there's about 4 steps to get through to the records. All the records are essentially prescriptions that you've been given. There's no record of the GP that you saw, your diagnosis, or any of the symptoms that you had. Whereas on the Israeli one, as you'll see in the next screen, it's not the case. This is just a comparable for the Israeli app where you see the prescriptions. And on the Israeli app, you can see all the medical professionals, all the doctors. So this is a list of the doctors where you can basically tap on it and then get more information about exactly what was discussed and what was concluded in each doctor's appointment. You then have test results, including the chemistry results of your medical appointment, all within the app. And that's something that's sort of ubiquitous across all healthcare, all the healthcare in that country. And every single patient has everything 100% digital. And I think there's some great things happening in the UK as well. So in terms of the data, at least, we can see the excellent work that was done here, where this particular dashboard gets 19 million views a week from the general population, who again are informed. In fact, we were looking at this today in a separate meeting that we had with our management team, just having a look at the data to kind of almost kind of make decisions on a gathering that we were planning to have. So it's an extremely helpful, professional, and useful dashboard. So I think there are kind of beacons of lights, and I think there's some really great progress in this country as well. Naturally, none of this would be possible without all of the, the data scientists and professionals, across kind of the UK that are working on these sort of capabilities. And things are kind of heading into, a really kind of exciting place where more and more data is being generated. So things like genomics, for example, where one could potentially see, family hereditary kind of health conditions, and then kind of use that data in combination with sort of their medical records and the results of tests to sort of further improve their lives. It unleashes tremendous possibilities to inform users. Obviously, there are sensitivities around, genetic data being sort of revealed and being accessed by, let's say, an insurer. So of course, there are some controversies here as well, but again, all this kind of data needs to be mapped out into some sort of data strategy where users should really be able to access this data, connect the data together, and kind of seek their own conclusions. Now, there's further kind of developments as well, like conversational UI and AI, for example, is a really exciting area here. And I'm talking obviously both kind of on the clinical side as well as kind of the patient side. But in this particular example here, an Israeli company called Vocalist basically took 1,500 voice samples of users that of coughs, basically to create a pilot sort of COVID-19 screening tool. So the tool was not intended to provide definitive medical diagnosis, but was there to help clinicians sort of triage potential cases. So whilst it's probably not sort of a commercial product that's ready to go, it's an interesting development, and this was published in Nature magazine. So as we saw earlier, sort of virtual consultations are increasing. medical, obviously staff and GPs are spread extremely thinly. So if you can just imagine like a care home or a large school with thousands of pupils where you don't have access to a GP, telemedicine and kind of internet of things, kind of medical devices can be used in tandem with like video consultations to really provide healthcare professionals with better kind of medical diagnosis data. This is actually one of Cyberduck's clients, a company called Techie Health, who are actually, we're working with them on kind of their product innovation and helping them with their business at the moment. So just to sort of wrap up, we're getting towards the end now. So, it's a great quote from the CEO of NHSX, where patients need to own their data and obviously have confidence of how their data is going to be handled. And the future of healthcare should be not just about data saving lives, but effective data preventing and predicting illnesses. It can then be used as personalized medicine. Customers should have, or patients should have, control over their data. They should be able to not only see their data, but connect it to the services that they want to make it portable. So if somebody's moving from one country to another country, they should be able to take their data with them. Obviously, this is kind of where something potentially like blockchain could be used. We haven't really covered that today, but clearly from a technological perspective, there's lots of kind of ways that data could be stored. And users obviously should not be informed by social media alone. I think the government has a duty to engage kind of GPs and kind of community centres, so they're actually communicating with users like us about the data strategy. We do have a great sort of book that we'll put in the chat, which is a free book about sort of user-centered design and how it can be used to design better products, systems, services, and ecosystems. So hopefully you'll download the book, which is again a free download. So it's been great to chat to all of you, and I'd be keen to sort of take any sort of questions that you may have. So I'm just going to stop screen sharing now.
Thank you so much, Danny, for such insightful talk. Over to the audience now for some questions. I can see some emerging already. Thank you in the chat. Please continue adding to them. I'm just going to kick off while people are thinking of their questions with my own. And we're thinking quite a lot about trust at the Open Data Institute as well. And you named trust as one of the key barriers. And you mentioned transparency being important and communication. And you also mentioned reaching community centres and using GPs for communication at the moment. So how do you think, do you have any ideas about how that communication might happen, or what the best ways of kind of marketing, as you put it, this new way of doing things, how that would work?
Yeah, I think first and foremost, it's a marketing challenge, isn't it? Because if we can get everybody together and to agree, yes, this is an amazing data strategy, because obviously not everyone is like us. We're obviously, all of the people in this Zoom call are data professionals and have above average kind of intelligence and knowledge of data, right? So we're sort of all informed. But even here, some of the views may be very polarized, with some of the people on this particular call being very sort of anti, like a company like Google, for example, having access to medical data. So I think the only way you can really kind of, because there's always going to be a difference of opinions, right? But if we can get the majority of the population to agree to a data strategy, I think the key kind of word here is clarity. Like it's basically clarity and acceptance. So it needs to be absolutely clear what we're doing and why we're doing as a society. There needs to be a conversation as well. So it can't just be a one-way street where, Matt Hancock says this and everybody says yes. It's not going to happen. There needs to be dialogue. So there needs to be more. It almost needs to go through optimization in terms of the data strategy. It needs different phases in terms of its communication plan. And the reason why I mentioned kind of GPs and communities is because when somebody walks into a GP surgery, there can be posters, there can be flyers, And equally, like I didn't get anything through my letterbox to talk about the this particular kind of data strategy by the government. I only found out when bad press, most people are only finding out when there's negative press. By that point, it's too late. You've lost the battle. So it's a bit like, you need to kind of rally the people behind you. You need to get people excited about it, explain the benefits through, and the reality is different people want to be communicated to in different ways. Some people, like a blind user, won't obviously benefit from getting a flyer in the post because they're blind, right? So they'll probably prefer to get an email or something that their screen reader will be able to read out that particular message. Part of the problem that we have is the NHS doesn't communicate to the general public using emails, does it? So there's a huge kind of missed opportunity. You're missing out tens of millions of people by not using email as a channel. The question is, why don't we use email as a channel? Other countries are using email, even WhatsApp, as communication methods. So I think there's a variety, of kind of almost channel tactics that can be used to communicate to people about the data strategy, and potentially even make it a two-way conversation as well, with a very clear kind of plan, because it's all good and well to publish something on gov.uk, but to actually make it happen is much more difficult. And I think you have to have the community on board.
Thank you, Danny. I have a question from Jenny. It was a private message to me. Jenny, would you like to ask the question, or would you prefer me to?
Yeah, I can do that. So it's about the ministerial forward in the draft data strategy, where it says that now is not the time to slow down or pause for breath. And I just worry that there's a risk that we're going to carry on in this sort of pandemic emergency mindset and lose touch with the kind of measured critical evaluation that's needed to build a safe and sustainable health data infrastructure.
Yeah, I think absolutely. I think there's, sometimes you need to stop. You need to, slow is the new fast, right? So sometimes you need to slow down to actually achieve the right results and the right strategy. And I think if something like this is rushed, I mean, you could argue that this has been going on, since the days of Tony Blair, right? So he was the one, or his government at the time, wanted to digitize the whole NHS, and equally speaking, in America, they have the same kind of problem as well, where I think it was George Bush #1 who tried to do the same thing in the 90s. So it's not an easy thing, and I think there's been various kind of strategies being developed over the years. So I kind of, maybe those particular words, and that particular kind of, I just think things are breaking down, right? Because there's just been an initiative now, and people have kind of thrown that out the window, and they've had to do kind of a bit of a U-turn. So I do agree that slowing down is actually the right thing to do. But equally speaking, I think from a technology perspective, technology architecture, data strategy, there needs to be kind of better communication, because, what does it actually mean in terms of the words that he said? It's still, you have to dig through hundreds and hundreds of words just to try and find what the solution actually is. So I think there's an issue around, okay, what is the solution and why is the solution good? And I think that's not clear at the moment.
Thank you. Thanks, Jenny, for the question. Fran, I'm not sure if this is a question or just a comment from you. Fran, would you like to share?
Yes, hello everyone. Thank you for this very excellent presentation. I think one thing which is probably not, excuse me, I have some lung disease. Something which is probably not well known, although it should be, is that in 3 different areas of England, as I speak, in Northwest London, in Nottinghamshire, and in Surrey, we have seen the implementation of a total integration of the NHS app, NHS login, and the Patients Know Best patient portal which means basically that the patient is really at the center of digital health record. The patient owns the data and receives via smartphone or laptop or tablet, according to the patient's preference. They receive information from their hospital, lab tests, x-rays, anything that the hospital provides after hospitalization, during outpatient clinics, all the tests, imaging, etc. They also receive their GP record. And what we have seen in Northwest London, and I think Nottinghamshire is adopting that as well, is we now have social care as well. So basically, I'm at the center, I've got my laptop, and I've got all these feeds coming into my integrated patient record. It has different names. In Northwest London, we call it the Care Information Exchange. In Nottinghamshire, they call it Connected Nottinghamshire. And I must confess that I don't know what they call it in Surrey. But basically, the patient owns the data and can also give access to whomever they want on this planet, on this globe. It can be to their next door neighbor if they have an informal carer. It can be their community pharmacist. They can give access to another clinician if they want a second opinion, or if they're elderly and they have children living elsewhere, even in a different country, these children can still take care of their parents and help them monitor the data. In terms of giving access, there are 4 different categories: general health, sexual health, mental health, and social care. So if, sorry, I do apologize for my breathing issues. If the patient, for instance, doesn't want anyone to know that they've had mental health issues, that they're under medication for mental health issues, or they have been hospitalized or anything, they don't have to give access to this part of the information. It works extremely well. It's actually in Northwest London, which is where I live and where I use this wonderful integration of different technologies all together to benefit the patient. We're now seeing an adoption rate of about 700 people a day. The main issue we've had in Northwest London, probably more so than in Nottinghamshire, is that there's been no marketing. As Danny, in fact, has mentioned several times, marketing is a big issue. The NHS has been and is very bad at communicating even the good news. I mean, the NHS does wonderful news. We don't know about them. So we've had this problem with this integration, but I would advise everyone, and you have my email address, and anyone is welcome to contact me, to basically look into this integration of different technologies, since the NHS app started as an app basically for smartphones. PKB started 10 years ago as a patient portal, very much as a web-based portal. Anyway, the reality today is that we're having this great integration, and which is wonderful. We need to make some noise about it, and I think that's what I've been trying to do. And thanks again for inviting me to speak.
That was great to hear, Fran. I mean, I have heard of quite a few pilot schemes. I mean, I live in Northwest London myself, and I haven't heard about kind of Northwest London being integrated into this, and nor have I kind of, so I guess it depends. I mean, I haven't, been to a doctor in a while myself, so that could potentially be why, but people in my family have, and I haven't heard about this, besides what I read obviously in kind of the news and things like that. So it is quite interesting.
Thank you, Fran. Really appreciate that that input there. Neil, you have a question. Would you mind sharing it?
Yeah, it was essentially just to come back to something I think Danny's touched on about the trust issue and who is providing those safeguards, because that recent incident leaves a very bad taste in the mouth. So I just wondered if you could talk to that maybe a little. Thanks.
Yeah, I mean, absolutely. I mean, the trust is obviously a critical challenge. So even with what obviously Fran was talking about now, which I've heard of these pilots I think I've heard about one in Cambridge as well. You hear about it, but you don't, it's not really clear where the data resides, you know, who has access to the data. You obviously hear about, particularly about organizations like DeepMind, which is owned by Google, using things like machine learning for various kind of scans to kind of almost like provide extra capabilities to the NHS to empower clinicians like cardiologists and opticians. So obviously, you know, whilst this type of AI and machine learning makes medical professionals more empowered, which in turn gives us, you know, as sort of, I guess, patients or users, faster services, better services, more accurate services. There's still a problem around trust, which is, you know, where is the data? Who owns the data? Is it really us owning the data? And I think what Fran was talking about there with kind of like where you specifically authenticate or authorize different kind of third parties who may want access to your data. I think that's critical. So once it's clear where the data is, who owns the data, you know, is it owned by yourself? Is it owned by the government? Where is the data stored? Who has access to the data? As well as kind of the different levels of consent around, you know, can, for example, a medical researcher access my data versus can Google access my scans to provide a better service to a cardiologist, as an example. So I think once all of that is presented in a way that is extremely clear, I think that trust, you know, can potentially be restored. Saying that, I think certain individuals will want even more information, you know, like where are the data centers located? Is it on blockchain or not? What happens in the event of a hack? So there's lots of obviously questions, and I think trust, different people based on kind of their persona type will require different levels of persuasion and detail, but trust can only really be provided through credibility, communication, and obviously that this kind of almost emotional feeling that we have around our data.
Thank you. Thanks for your question, Neil. We've got time for one more question. Yang, would you like to read out your question to Danny?
Oh, hi, Danny. Hi. I see your presentation touch quite a lot about transparency. So when the patients are given the informed consent to read through and tell them, probably we release more details about how the data will be used, would increase the transparency. But I also think of in the perspectives of medical researchers or clinicians. Maybe we hope patients can actively, you know, share their records. Do you think to release some benefits, for example, societal benefits or good for treatment development would be something positive in this regard? And can you talk more about different types of benefits that a patient would be likely informed?
Yeah, so I mean, I think it's really important for patients to kind of want to, you know, share their records specifically for medical research, right? Because as you know, data scientists, medical practitioners, and you know, all of these sorts of PhDs, right, that take data, crunch data, build, you know, predictive and kind of personalized models. Without data, they can't do their jobs. You need sort of large quantities and samples, or they do, medical researchers, right? So I think, again, it's a marketing problem. You know, users or patients need to be taught these things, because unless you have a friend who's a medical researcher, you're not necessarily going to understand why it's important for your data to be essentially anonymously, you know, or using pseudonymization, for example, for somebody to do medical research on you. So that there's, you know, whether it's through the NHS app or a website or further kind of marketing material, there needs to be a push and an effort to explain to patients, you know, it's important for you to share your data anonymously. You know, it's not going to identify you, but it's going to help a medical professional or scientist to improve, you know, the future of healthcare and save more lives. So I think it's a marketing problem in my view.
Thank you.
Thanks for your question, Yang. Okay, I think it's time to wrap up. So thank you again, Danny, and thank you to the audience for all your great questions and some of your insights as well. Please join us again next Friday. We've got Sharon Richardson, who's a senior scientist at the University of Zurich, asking, can an AI detect emotion? Big question. You'll find it on the event section of our website, so please do sign up and join us next week. Thanks again, Danny. Thanks to everyone for joining us, and see you all soon. Have lovely weekends. Bye-bye.
Thanks, guys.